Hello and welcome to a special interview for The Wire supported by Glenlivet Books. Do the facts suggest the second wave is nearing its end, or would that be a premature conclusion? And is there going to be a third wave, or is that unlikely? Those are two issues I shall raise today with Professor of Biostatistics, Epidemiology and Global Public Health at the University of Michigan in America, Bhramar Mukherjee. Professor Mukherjee, let's start with the broad, big COVID picture facing India today. At the moment, cases are increasing between 16,000, 18,000 every single day. But if you look at the weekly average of daily cases, that's been steadily declining for weeks. And the Times of India says that for the week ending the 10th of October, it was the lowest it's been for 7 months. Does that suggest that the second wave is now nearing its end, or is that a premature conclusion?
Thank you, Karan, for having me on your show. Before I talk about COVID, I want to wish all of your viewers Shubho Bijoya, as Bengalis will say. I hope everybody is connecting and reuniting with friends and family. So talking about COVID, if we map these case counts back to a past point in time, it will remind us of January of 2021, where the case counts were at 19,000. And then it kept going down until February, and it was at a 10,000 mark before it started going up again. So do we really expect that to happen this time as well? I would say no. I personally feel the worst is over. Our models never predicted a towering third wave, as many models said, the imminent projections right after the second wave. I recall I went to your show in July and said that we do not see a third wave, but we should be very cautious. We should not let our guards down. We should keep doing the work for being prepared for a pandemic. But I think the worst is over.
Let me ask you specifically about Kerala, a state that has been a cause of concern for several weeks, if not months. Even there, the daily increase in cases is now under 10,000. That's been the case for the last 5-6 days. And if you look at the weekly average of daily increases, for the week ending the 10th of October, it was 17% below the week before. What does that tell you about Kerala? Could it also have turned a corner?
So as I mentioned in several interviews before, India is multiple nations within nations. So we saw this heterogeneity across Indian states, and Kerala was registering about 50 to 60% of India's case counts for the last few weeks, and it still is. But it is declining, and the R for Kerala is now at 0.8. which is steadily below 1. The R for overall national R is also 0.85. These are all very encouraging. I was never quite worried about Kerala because it's somewhat to be expected. They have a very good testing system. They catch 1 out of 6 cases, whereas in all over India, it's 1 out of 25 or 1 out of 30. Vaccination among the large states is quite high in Kerala, with 70% of the total population having at least 1 shot. And the case fatality rate in Kerala has been one of the lowest across Indian states. But in terms of projections, we also do see Kerala going down in terms of the next 4 to 6 weeks.
So to use your memorable phrase, is the worst over for Kerala as well?
So in this pandemic, we have taken a lot of decision and made a lot of comments based on incomplete information. But given all of the parameters we have right now, there is a lot of unknown. There are unknowns about, the virus mutation. There is unknown about breakthrough infection. There is unknown information about reinfection rates and how long immunity lasts. All of these things are there. But given what we have seen in the 18 months, I feel hopeful that we are at the end of a very long tunnel and I can see the light.
You're talking specifically about Kerala?
Yes.
That's wonderful.
As well as I think globally too, I feel like, there is some sense of resuming normalcy and getting our life back again.
Let's stick not to the global picture, but to the Indian picture. Let me put to you 2 reasons why some people are still concerned. There are 34 districts nationwide in India across 9 states and union territories where the positivity rate is still above 10%. And there are a further 28 districts across 12 states and union territories where the positivity rate is between 5 and 10%. How concerning is that?
So, you have to look at it holistically. You have to look at not just test positivity rate. You have to look at the rate of hospitalization. You have to look at the rate of severe cases. One problem that we saw in the United States as well, even if overall a large number of people were vaccinated, there were pockets of heterogeneity in terms of vaccination. There were countries and there are states and districts which had low rates of vaccination. In India as well, we see a lot of heterogeneity in terms of the vaccination. So for example, we see in Bihar, in Uttar Pradesh, in Nagaland, we see lower rates of vaccination compared to the whole country. So we have to be cautious and watch the data, but I am fairly hopeful.
So you're not particularly worried by the fact that there are 34 districts with over 10% positivity and 28 others with over 5%. You're not particularly worried about that.
The overall test positivity rate in India has been steadily going down, and it's about 1.5% right now. So that makes me feel hopeful that there are heterogeneity and we have to continue our surveillance. We have to do all our work, but I don't feel a sense of despair.
One more point of concern. Sita Bra Sinha of the Institute of Mathematical Sciences in Chennai has calculated that the R number in 4 cities, specifically 4 cities which are Bombay, Calcutta, Bangalore, and Delhi, keeps popping above 1, then it dips below 1, and then it pops above 1 again. Does that suggest that at least in these 4 cities, the situation is precarious, and if we're not careful, it could turn to the worst pretty quickly?
So again, I want to point out that R is a relative metric. And right now, for example, in Delhi, the number of case counts is very small. So there is a lot of uncertainty and variation in R because we are seeing about 30 cases. And even from 30 to 35 can give you a large change in R. But that does not mean that in terms of the absolute numbers, there is going to be a towering peak. About Mumbai and Calcutta, I think with the festival season, I feel a little bit more anxious and nervous. But again, I think that with the vaccination and even with reopening and vaccination and people being a little bit more cautious, I think we can bypass a really precarious situation.
That's a very important point you made, that the R number depends upon the number of cases. You took the example of Delhi. Delhi has roughly 30, 35 cases a day. Even if that goes up on 1 day or 2 days to 40, the R number changes significantly, but actually it's not a great number of cases, and one can't make predictions on the basis of that small rise in R going up or a small dip in R going down. That's a very important point you've made, and I think people should bear that in mind when we read about R numbers changing or crossing 1 in specific cities. Let me then come at this point to a question that I think is at the top of everyone's mind. Will there be a third wave? And if the answer is yes, how severe will it be? And I'll point out to the audience that at the University of Michigan, you have perhaps the world's best modeling, particularly with reference to what's likely to happen in India. So what do your models suggest about a third wave?
First of all, good science does not claim any kind of supremacy or bestness. So I would like to say that our model was one of the competent models and it did a good job. I do not think that our model ever engaged in this imminent third wave prediction. I wrote an article in June in Times of India where we said that we do not see any third wave, and people were really talking about third wave as if it's a destiny and children are going to get affected. We did not see a towering third wave. And I think that I always have insisted that we have to be prepared for outbreaks, because even if in a highly vaccinated population, we will see outbreaks and we have to be prepared to control them. Look at Singapore, for example. It has its highest peak in terms of the number of infections after 80% population was vaccinated. And we have a lot of unknowns here that we do not know, but very few fatalities and hospitalizations. So we have to be prepared for that eventuality. But according to the models and everything that we know now, we do not predict a severe third wave in the next future. There may be bumps and undulations in different parts of India due to changes in human behavior, due to vaccine heterogeneity, but we do not see anything like the second wave.
So then I take it you agree with something the finance secretary said the other day in India, and I presume he was speaking for the government as a whole. He said a third wave is unlikely. And your models are also saying that you do not predict a severe third wave. You may see bumps, you may see ups and downs, but your models do not predict a severe third wave.
Yeah, one thing I'd just like to mention that I saw tremendous certainty about the third wave happening in June and July. And in the revised statements, I see tremendous certainty about the third wave not happening. I think it's the nature in me as a statistician is that I embrace uncertainty and I want to proceed with the humility of knowledge that, I do see what we see in the models and I present that, but I'm also aware that there is a lot of unknowns and things could change.
Absolutely. But the models, and I'm repeating it because I think this is something that will reassure people, the models do not suggest a serious third wave. In fact, they don't suggest a wave at all in the sense of a nationwide phenomenon. What they show is regional and local ups and downs. And secondly, those regional local ups and downs will not be severe, nothing like the dreadful wave we experienced with its awful peaks of 400,000 cases a day in April, May. Nothing like that. Small, local, regional ups and downs, nothing nationwide, nothing frightening.
I feel so. But at the same time, if this message prompts us to let our guards down and think that COVID is nothing, that will also be a wrong message. So absolutely. I really want to strike a balance between alarmism and denial and emphasize that we still have a lot of work to do.
Absolutely. And I come now to what, in fact, needs to be done to ensure that our laxity and our carelessness and our irresponsibility doesn't create a third wave, even though your models don't see it at the moment. But I'll point out first that what you're saying about there not being a nationwide third wave, but only having regional and local ups and downs, and that those regional and local ups and downs won't be severe, has also been said to me by Professor Soumya Swaminathan of the World Health Organization. She's their chief scientist, as well as separately by Professor Gagandeep Kang of the Christian Medical College in Vellore. You're agreeing with their view, but except you're saying it on the basis of your modeling, and your modeling clearly shows there is no third wave nationwide lurking around the horizon. It cannot be seen. You'll have local and regional ups and downs, and they won't be severe either. Let's then come to what could be a point of concern. As you know, Dussehra was yesterday. Diwali is on the 4th, Chhath Puja on the 10th. And we've all seen pictures from Calcutta showing massive crowds during the Durga festival period in Calcutta. And already newspapers in Delhi are reporting massive crowds in markets in Delhi. And if that continues and builds up till Diwali on the 4th and Chhath Puja on the 10th, how worried would you be?
Yes, so personally, I'd have to say that I'd rather be I'm fully vaccinated. I have taken my booster. I'd rather be on the streets of Kolkata than being in a sterilized home in Michigan. But I would actually wear masks out, when I'm in the vicinity of many people. I have been wearing masks, indoor gatherings with people whose vaccination status I do not know. I will wear masks. And I feel that breakthrough infections are going to happen. Even in my own community in Michigan, which is a highly vaccinated community, we are seeing breakthrough infections. And some of those infections are serious as well. People do suffer. It's not like asymptomatic. So I think that only reason I feel a little anxious is that we do not want all breakthrough infections to happen at the same time due to this massive gathering of people without any precautions.
So what you're saying, what you're saying is clearly big gatherings around Diwali, Durga Puja, Chhat Puja are unavoidable, particularly when the numbers are down to under 20,000 and falling. But you're saying wear masks, particularly when you're with a lot of people, particularly when you don't know their vaccination status, wear masks.
Yes. Yes, I'm absolutely recommending that.
Let me come to something else. Although today, just over 73% of the adult population has had one jab, and pretty close to 30% have had two jabs, it's also almost certain that India is not going to meet the target the government set of fully vaccinating every adult before the end of the year. But given the present circumstances, given the fact that seropositivity came in nationwide at nearly 68%, given that the numbers are declining, how worried are you by the fact that we won't make that target of fully vaccinating every adult before the end of the year?
So I think that given at one point of time, India is vaccinating about 3 to 5 million people every day, and that number has consistently gone up. And I'm hopeful that they are going to vaccinate, they're going to meet the vaccination target, and also quite soon, because if you are counting on infection-induced immunity and you're assuming that most people got infected in April and May, there is a waning of that immunity potentially at 6 or 7 months, given the data that we see. So I think that we need to really accelerate vaccination by January, February, and I know that there has been a lot of progress. We are approaching the 1 billion vaccination landmark.
Yeah, but let me pause. We may be approaching the 1 billion landmark, but we're nowhere near succeeding in fully vaccinating every adult. Only 30% of adults are fully vaccinated. So my question remains, even though infection levels from getting COVID may be quite high at around 67, 80%, would you be worried if the target of fully vaccinating every adult isn't met? Or in the present circumstances, are you less worried and more sanguine?
Right. So I do feel worried because I think we need to really reach all populations uniformly. And there are vulnerable pockets of population that really worries me quite a bit about India and about other countries as well, that the access and the reach is not uniform. I also want to say that I do not like this word fully vaccinated. I would really like to coin the word fully protected, because this actually can change. We have already seen in the United States the need for booster doses with the Pfizer vaccine. In India, at some point of time, we'd have to think about that. We do not have the data yet. And I also know that in the first leg of vaccination, many people got vaccinated where the dosage gap was 4 to 5 weeks. And so I worry about all of this dosing, all of this heterogeneity, and having more data for the need of booster.
Okay, that's very clear. In other words, you would feel a lot happier if India could meet that target. And if it doesn't, regardless of all the other mitigating circumstances, you would be concerned if India misses the target. Now, we're coming to the end of this interview, and I will at this point raise the issue you raised, which is in fact the global situation facing the world. In the interview she gave me on the 24th of August, Professor Soumya Swaminathan, who's the chief scientist of the World Health Organization, said that she hoped that by the end of 2022, COVID-19 might convert from its present epidemic status to an endemic status, of course, helped hugely by vaccination and also helped by COVID-appropriate behavior. And at that point, December 2022, she felt it would be no greater a threat than, say, influenza, because we would learn to live with it. From your point of view, and from the point of view of the modeling you do, does that seem like a reasonable forecast?
Yeah, so let us go back to the definition of endemicity in mathematical terms. Endemicity means that we are going to maintain this disease at an expected level without any external input or imported cases or new variants. That's the assumption. And it depends on the R, or the transmissibility of the virus, as well as what susceptible population is left. And so the R for Delta variant, if we say is around 6 to 8, let us just say 6. that will imply that in order to be endemic, you will need the susceptible population to be somewhere around 16 to 17% population. So I wonder whether actually 85% people are protected right now to claim convincingly from a mathematical perspective that we have reached an endemic stage. So I think it's the statistician in me again, without knowing about the landscape of variants, if the virus is spreading in other countries and there is travel opening, I do not want to feel that optimistic and very emphatic in my proclamations. But also for me personally, COVID will never be like flu. We may learn to live with it again, but the imprints that I have seen through our research in terms of long COVID, I have not seen that with flu. I think it has caused a generational trauma and a healthcare burden that we have to deal with. So in my lifetime, I do not think that I will be able to perceive COVID as flu, though I'll definitely learn to live with it.
That's a very important corrective to what Professor Swaminathan said to us. Speaking as a statistician, you're concerned about all the variables that we don't know about that could in fact mean that the R number goes up, that we don't achieve endemicity quite as easily, or certainly not by December 2022. And a lot depends upon variants that might come up between now and then and just how infectious they are. After all, no one predicted Delta, and Delta swept through the world, kicking up cases in every single country. That's a very important corrective. And I suppose another concern you could throw in, and this is my last question, is that Professor Swaminathan's prediction of endemicity could also be undermined by vaccine inequity. If Africa doesn't get a decent amount of vaccination and the number of people vaccinated don't go up sizably, then we cannot have an endemic status in the world, because Africa will always be there with infections which will infect everyone else. Isn't that so?
Absolutely. Like, we are fighting this as one world, and now every travel restriction is gradually being lifted, and rightfully so. But cases are going to be circulating all over the world, and we have to control the pandemic in every part of the world to make sure that the virus does not come up with new surprises for us.
Absolutely. To use that phrase, which is almost a cliche, no one is safe until everyone is safe. And at the moment, by no stretch of the imagination is everyone safe. I thank you, Professor Mukherjee, for this interview. Take care, stay safe, and in advance, a very happy Diwali.
Happy Diwali to you and your viewers as well, Karan. Stay safe.
Thank you.
Thank you.